John from Physio here. Does every torn ACL need to be reconstructed? Well, the answer is yes and no. It all depends really on what you're trying to get back to. If you're returning to a level one change direction type sport, then it's really important to probably consider a reconstruction. And that's because the change of direction will lead to instability. Those sports include AFL, rugby, football, netball, tennis. Anything that is cross-directional will create instability opportunities at the knee. It's also important to consider whether you've had meniscal damage, because meniscal damage, if untreated, will actually lead to earlier arthritic change in the knee. So we now have 4 treatment options. We have early surgical reconstruction. They're generally undertaken by professional athletes who need to return to sport quickly. Then we have the delayed surgical options, and they are the ones that are delayed for about 3 months. These have been shown to be effective for recreational athletes, and it's important to note that generally they will do better with less chondral damage, which is an early arthritic change in the knee. The third group is really a bracing technique, and it's actually just been recently researched, and there's a growing body of evidence that certain groups, if we actually keep them in a restrictive brace for about 12 weeks, will actually start to join back together. But there's a lot of very critical criteria for those people to be successful. Then there's the 4th group, which is the exercise group. This is recommended for those who don't wish to return to a level 1 sport, they're non-professional, and as well they don't have meniscal damage. And that can be overseen by a physiotherapist who will guide your exercise rehab. So in simple terms, you've got 4 options. 2 of them are surgical, 1 bracing, and 1 an exercise-based one. Discuss this with your orthopedic surgeon or your physiotherapist.